This is a case of a chronic retinal detachment repaired with pars plana vitrectomy. Initially, there were lattice and holes, a chronic detachment. A scleral buckle was trialed initially, however, there was worsening of the subretinal fluid after initial improvement. Decision was made to then go inside and perform a vitrectomy. The posterior hyaloid was very adherent and there was a lack of countertraction. It was unable to be removed at the outset of the case. A PFO bubble was used to stabilize the macula and provide this countertraction. It's important in this portion to make sure that the hyaloid is at least lifted past the PFO bubble so that it doesn't get trapped underneath. We can then use this countertraction to pull and lift the hyaloid peripherally and propagate the vitreous detachment. This can be done with the flex loop and the vitreous cutter. It's important to keep an eye on the retina to make sure that there are no holes being made during this process. Once this is achieved, the PFO can be filled even further and the step repeated again. Now we're able to lift the vitreous to at least the 3/4 periphery, to the break. This also allows room for the subsequent tamponade. A fluid-air exchange was performed through the temporal break, and PFO was rinsed with BSS. Endo laser was applied to this break as well as 360. Silicone oil was placed in the eye, and the patient did well postoperatively with the retina attached.